name is Dr. Linda Biomdo, and I share informative medical videos on my TikTok page every single day. This is part 5 of the series where I talk about everything to do with family planning, the advantages, disadvantages, what are the options that you have, and hopefully this can help you to make informed decisions in future. Remember, this video is meant for educational purposes only. Let's get to it. Hiya. So emergency contraception is when someone engages in unprotected sexual intercourse and they'd like to use a device or medication to prevent pregnancy. First of all, if you did not know, when you just engage in sexual intercourse, the risk of getting pregnant is usually 5.6%. That is without the use of emergency contraceptive. There are different methods of emergency contraception, and one thing that we don't talk about enough is the different types of emergency contraception that are there, which ones are the most effective, the time frame in which you should take the emergency contraception, and the possible advantages, disadvantages, who qualifies for it in the first place. So first things first, if you fit any of the following criteria, this is when you can use an emergency contraception. Number 1, if you're a woman within the reproductive ages, that is most of the time it's between the ages of 20 to when menopause started. So if you've not started your menopause, you are a woman within your reproductive ages. Number 2, have you had sex within the past 120 hours? And remember, 120 hours translates to 5 days, not 72 hours. And I'll explain to you which emergency contraception can work even on day 4 or day 5 after indulging in unprotected sexual intercourse, because it's not limited to 3 days. It's just dependent on what method do you have access to. So the American College of Obstetrician and Gynecologists made a few recommendations about emergency contraception. Copper intrauterine device is the most effective form of emergency contraception, way more than the emergency pills that women take. In that case, gynecologists and obstetricians are usually advised to give that as the best form of emergency contraception. Hiya. Did you know that the copper IUD, in this specific instance, the copper T380 IUD, can be inserted up to 7 days after having unprotected sexual intercourse, and it can still protect you from getting pregnant. For the emergency pills, they are of 2 types. There's one that is the progesterone only, and then there's now the combined emergency pills, that is estrogen plus progesterone. For the progesterone, there's one that is called levonorgestrel, has been shown to be effective against getting pregnant within the first 72 hours. Now, these are the pills that you really have to take within the first 72 hours. And this is where you only take 1 pill, of course, within the first 72 hours, and hopefully it can prevent your pregnancy. How this progestin only pill, what we call levonorgestrel, the brand name is like things like B2 and Plan B works, prevents ovulation by preventing the luteinizing hormone surge, thus inhibiting ovulation in the first place or delaying ovulation. And if you're going to break it down to the molecular level, what happens is that it prevents follicular maturation and development. In this case, you can actually get the original tablets and you can also get generic tablets. They're all equally effective. So just depends on how much you can afford and how much you're willing to part with. The other one goes by the generic name of ulipristal, that is a progestin antagonist. How it works is that it inhibits the luteinizing hormone surge, of course, by delaying ovulation. It can also hinder the alterations of the endometrium, that is the wall of the uterus, thus preventing implantation. And that is where you've heard of certain churches going against emergency contraceptive, because sometimes they say that fertilization has occurred, so conception has occurred, and that's a human being. And some of the instances, the emergency contraceptive pills do not necessarily prevent fertilization. Sometimes fertilization has occurred, but then it prevents the implantation of the fertilized egg into the wall of the endometrium by altering the changes. So, quote unquote, to them, that is abortion, and that is killing like a human being. So it just depends on how you decide to look at it. Yeah. But the most important thing is that if you vomit within the first 3 hours of taking the pills, make sure that you take it again. It means that you might actually just have vomited the whole medication outside, and it might not end up being as effective as it should be. So what are the factors that could increase the failure rate, especially when it comes to the pills? Because some people will tell you that they actually took the emergency contraceptive pills and they ended up getting pregnant. So these are some of the factors. The first one is the patient's history on the last normal menstrual period, and for sure the date of exposure, that is the day of engagement with unprotected sexual intercourse. These things have to tally. Sometimes people do not have their dates correctly, so that can be a reason for failure. Number two, the effects of people who have amenorrhea, dysmenorrhea, like having regular or irregular menstrual cycles, that's affecting your date of ovulation. You might think that your ovulation date is on this particular day, but then since you don't have regular menstrual cycle, you might not be very accurate when it's, with regards to ovulation day. So you might actually end up having unprotected sexual intercourse on the day or the time of ovulation, and that of course increases your chances of failure. Of course, there's the possibility that the patient is already pregnant and did not know yet, and of course you might take emergency contraception for an unprotected sexual intercourse event that happened today, and yet you actually had unprotected sexual intercourse a day before or hours before. That of course increases your failure rate. So some of the disadvantages of emergency contraception are this. Usually it's not very common, but some people actually experience them. Things like nausea, vomiting, minor changes in your menstrual cycle, fatigue, breast changes. Sometimes the breast can get a little bit bigger, they can get tender, they can get a little bit warm. Some people can experience some low abdominal pain, dizziness, just fatigue in general. But the most important thing to note is that emergency contraceptive pills, or all the methods, actually including the copper IUD, are not effective the moment implantation of the fertilized egg, that's the zygote, has been implanted onto the endometrium or the uterus. So the moment that happens, the pregnancy will go on to mature. One of the side effects that's actually not talked about enough, that in my opinion should, especially when it comes to emergency contraceptive pills, is that it actually increases your chances of having ectopic pregnancies. Several studies continue to prove that this might not be the case, but then given that what we see in the wards and having managed so many ectopic pregnancies, we can tell you that what happens with these pills is that they reduce the cilia. The moment the egg has been fertilized, that egg has to be warped through the fallopian tube all the way to the uterus by day 3. What usually happens is that there's those two hairs, we call them cilia, that usually help with wafting that egg all the way to implantation site on the uterus. So what happens is with emergency contraceptive pills is that they weaken the cilia, and sometimes they affect the formation of that cilia, and in that case the egg does not travel as it should be all the way to the uterus, and one can end up having a ruptured ectopic pregnancy or unruptured, but generally it can increase the chances of ectopic pregnancy. And when you are in a public hospital, especially in a third world country like ours, and you get to manage the ectopic pregnancies in gynae ward, it's usually just abortions, ectopic pregnancies, abortions, miscarriages, ectopic pregnancies, and 90%, if not 99% of the patients who have had ectopic pregnancies, of course, there's the other risk factors. Most of them will tell you that at any point in time, they have an history of using emergency contraceptive pills. In that case, my name is Dr. Linda Biomdo. This is where we will end the video today. Click on that follow button if you find this video useful. Stay tuned on the series. If you want to watch the previous videos on the series, just click on that playlist button down there and you can actually watch all the videos that I've posted in this series so far. Thank you so much for watching this video to the end. See you in the next video. If you've not followed, please click on that follow button. See you. Bye.